So, hi everyone. Today we'll be discussing the venous drainage of head and neck. I'm Dr. Abhin Miglani, Department of Oral and Maxillofacial Surgery. So, discussing the veins. Veins are the blood vessels that carry blood towards the heart. Heart की तरफ लेके जाएंगी blood को. Most veins carry deoxygenated blood from tissues back to the heart except the pulmonary veins and the umbilical veins. So, coming to the structure of veins are thin walled than arteries. Vein have large lumen, have valveless that maintain unidirectional blood flow. These are all the basics of the arteries and veins. So, there are three concentric layers which we can easily learn by the mnemonic which has been marked in red in this slide. So the coming to the innermost layer, that is the tunica intima, so which is made up of internal elastic lamina, I for intima, I for internal elastic lamina, tunica media made for muscle tissues, and tunica adventitia or externa made of collagen. So comparing the structure of veins and arteries, so we can see here there is a thick tunica media in the artery, and the lumen is smaller in artery as compared to the vein. Histological comparison, we will be seeing that vein has a greater lumen as compared to an artery. So course of veins. So venous drainage from the face is highly superficial. So all the venous drainage from the head and neck terminates in the internal jugular vein, which later joins the subclavian vein to form the brachiocephalic vein behind the medial end of the clavicle. Two brachiocephalic veins unite to form superior vena cava. Here in the diagram, you can easily see the internal jugular vein, which later joins to the subclavian vein, and the subclavian vein later forms the brachiocephalic vein. So coming to the head and neck venous network. So here on the right side, you can see a 3D video of the venous network. So coming from the superficial temporal vein to the maxillary vein to the occipital vein, then posterior auricular vein, and then coming to the retromandibular vein. And here we can see the veins on the anterior aspect, like the supratrochlear vein, supraorbital vein, the facial vein, the angular vein, which is running from the lateral side of the nose. Then above, these are the extensions of the veins, and coming to the superior thyroid vein, anterior jugular vein. So this diagram I have made in rough. You can make the similar diagram in your exams as well. So this is a facial venous network. So to understand it clearly, we need to read it from below to up. So there we have the two main nerves, two main veins in the neck region, the external jugular vein and the internal jugular vein. So these veins are the tributaries make the larger veins. Okay, so internal jugular vein and external jugular veins are the two large veins of the neck, which are formed respectively by the combination of posterior division of retromandibular vein and the posterior auricular vein. I'm talking about the external jugular vein. Okay, and secondly, to form the internal jugular vein, we need to form a combination of a facial vein and an anterior division of retromandibular vein, which will join as a common facial vein to together coalesce into a internal jugular vein. So the supratrochlear vein, the frontal vein, which is also known as the frontal vein, on the left side we can see the dissected model, and on the right side we can see an anatomical 3D image. Then coming to the supraorbital vein, so on the left side you can easily see that the supraorbital vein and supratrochlear vein coalesce or the merge into form superior palpebral vein and angular vein, which move downwards towards the inferior palpebral vein, which later joins to the infraorbital vein to form the facial vein. Internally, from the cavernous sinus, we can see that one major vein is coming from the upper side, that is the superior ophthalmic vein, which further moves towards the lacrimal vein. So this is all eventually draining into the facial vein. So supraorbital and supratrochlear vein, so these veins drain the scalp. Supratrochlear and supraorbital veins start on the forehead from venous network, which connects to the frontal tributaries of the superficial temporal vein. These runs downward superficial to the frontalis muscle and joins at the medial angle of the orbit to form the facial vein, the angular vein. So, what the surgical importance is that whenever we do nasal reconstructions, so the designing of paramedian flap is in nasal reconstruction requires a great anatomical knowledge in that respective area, which comprises of the supratrochlear vein and supraorbital vein. And coming to the facial vein, one of the most important veins of the head and neck, the facial vein. Okay, so here on the right side we can see wait uh, near the anterior border of the masseter we have facial artery and the facial vein. Okay, so we'll be discussing the relation of both the vessels in relation to each other in the coming slides. Wait just a second. Okay, so the facial vein anastomosis with the infraorbital vein, the mental vein, and joins the pterygoid plexus to the deep facial vein, the cavernous sinus to the superior ophthalmic vein. In this diagram, we have clearly dissected the masseter muscle. So, and also the ramus of the mandible has been removed, and henceforth we can see that the facial vein runs from the upwards to from the infraorbital foramen towards the submandibular gland region, and the superior temporal superficial temporal vein coming from the ramus region, from the root of zygomata region downwards, and finally forming into the maxillary vein and then into the retromandibular vein. Okay, so the relationship between the facial vein and the facial artery, as I told earlier, that will be discussed. So the facial vein courses parallel to the facial artery. It commences at the side on the root of the nose, formed by the union of the supraorbital and supratrochlear veins, and the facial vein lies posterior to the facial artery, and its course is less tortuous as compared to the it is less tortuous, and the facial vein is located more superficial to the facial artery. So in this diagram also we can see that supratrochlear and supraorbital as a V shape form a V shape to form towards the from the medial canthus of the eye to form the from the facial vein, which slowly runs towards the angle region near the anterior border of the masseter muscle. So the facial veins have no walls and it connects to cavernous sinus by two routes. So the first route is the ophthalmic vein or the supraorbital vein, and the second route is via the deep facial vein to pterygoid plexus and hence to the cavernous sinus. सो कमिंग टू द ट्रिब्यूटरीज ऑफ द फेशियल वेन, सो ये तो हमें रटना पड़ेगा, ये पूरा ही हमें सारे के सारी जो इतनी भी ट्रिब्यूटरीज हैं सब याद होनी चाहिए. सबसे पहले आएगा सुपीरियर ऑफ्थैल्मिक वेन, देन वेन्स ऑफ आला ऑफ नोज, then deep facial vein from the pterygoid plexus, then inferior palpebral vein, superior and inferior labial veins, buccinator veins, and parotid and mesenteric veins. And below the mandible, it receives submental, tonsillar, external palatine, and some mandibular veins. So coming to the dangerous area of the face. So here I have made a rough diagram on the left side. The bridge of the nose, angle of the mouth, and these forms a triangle, which is also known as the maxillofacial death pyramid. So the facial vein communicates to the cavernous sinus through three deep connections: the superior ophthalmic vein, inferior ophthalmic vein, and deep facial vein. Okay. So the route of infection spread, we can see in the right side that dangerous area of face, facial vein, deep facial vein, emissary vein, cavernous sinus. So what are emissary veins? So the emissary veins are the veins which connect the extracranial component to the intracranial components. So these all affect the third cranial nerve, fourth cranial nerve, V1, V2, sixth cranial nerve, and internal carotid artery, which are all the contents of the cavernous sinus. Okay, which eventually leads to the infection towards the circle of Willis, leading to meningitis and death. So, the facial vein is a common source of bleeding following surgery involving posterior vestibule lateral to mandible. So, infection from the face can spread in a retrograde direction and cause thrombosis of the cavernous sinus. This specially occurs in presence of infection in upper lip and lower part of the nose, called the dangerous area of the face. So this person suffering from cavernous sinus thrombosis. So the thrombosis caused by sepsis in the danger area of face, nasal cavity, paranasal sinuses gives rise to nervous symptoms. So as discussed earlier, that the nerves which lie within the cavernous sinus or pass through the lateral wall of the cavernous sinus. So whenever there is an infection, there is the involvement of these nerves causing the nervous symptoms. So involvement of third, fourth, and sixth cranial nerves, resulting in paralysis of the muscles they supply. For example, the superior oblique muscle of the eye is the extraocular muscle which is supplied by the cranial nerve 4. Similarly, the lateral rectus muscle which is supplied by the sixth cranial nerve. And then coming to the venous symptoms, so the marked edema of eyelid, cornea, and exophthalmos due to congestion of orbital vein, carotid and cavernous communication because of peculiar relationship of cavernous sinus to internal carotid artery. A communication may occur between the two as a result of injury. When this happens, the arterial pressure is communicated through the sinus to vein of orbit, and as a result, the eye becomes prominent and pulsate with each heartbeat, known as the pulsating exophthalmos. So, as discussed earlier, these emissary veins, the which connect the extracranial and intracranial components. So, this all has been discussed before. Just you can make the similar diagram for your exams. So, to superficial temporal vein. So, it drains the scalp, crosses the posterior root of zygoma, and enters the parotid gland to unite with the maxillary vein to form the retromandibular vein. Coming to the maxillary vein, so vein from the pterygoid plexus, which passes between the sphenomandibular ligament and the neck of condyle to enter the parotid gland, and here it unites with the superficial temporal vein to form the retromandibular vein. So coming to the retromandibular vein, so maxillary vein plus superficial temporal vein forms the retromandibular vein. Then it passes downwards in the substance of parotid gland, emerging from its lower border and divide into two divisions. Then the anterior division joins the facial vein, and the posterior division pierces the deep fascia and joins the posterior auricular to form the external jugular vein. It empties into the subclavian vein. So coming to the retromandibular vein, so here we can see the retromandibular vein is dividing into an anterior retromandibular vein and a posterior retromandibular vein, and we will be discussing how they join together to form an internal jugular vein, external jugular vein. Then coming to the retromandibular veins applied anatomy. So the formation of retromandibular vein by union of the superficial temporal vein and the maxillary vein mostly occurs at the level higher than the passage of the main trunk and branches of the facial nerve, where they laterally pass to the vein. And in open surgical reduction of the mandible condyle fractures, the facial nerve and its branches can be localized by using a superficial temporal veins and the retromandibular veins as a guide, even in the abnormal course of the nerve. So the this is the lateral view, the facial nerve, superior division, inferior division, uh, distributes itself through the retromandibular vein. So coming to the posterior auricular vein, so drains the scalp, begins on the side of the neck in a plexus, which communicates with the tributaries of the occipital vein and temporal veins. So this descends behind the auricle and joins the posterior division of the retromandibular vein to form the external jugular vein. So coming to the occipital vein, so it begins in the posterior network in the scalp, pierces the cranial attachment of the trapezius, turns into suboccipital triangle and becomes deep, may follow occipital artery to end in a internal jugular vein or join posterior auricular and hence external jugular vein. Lingual vein, so it drains the tongue and sublingual region. It has three branches: dorsal lingual vein, deep lingual vein, and a sublingual vein. Coming to the dorsal lingual vein, so the dorsal lingual vein passes posteriorly and joins the vena comitans of the hypoglossal nerve to form the lingual vein. It eventually drains into the internal jugular vein near the greater corner of the hyoid bone. It drains the dorsum and sides of the tongue, runs along the lingual artery. So this diagram you can refer for easy understanding. Coming to the deep lingual vein, originates at the tip of tongue and is visible through the mucosa on the undersurface of the tongue. It runs backwards on the inferior surface of the tongue and joins the sublingual vein to form the vena comitans of the hypoglossal nerve, then drains tip of inferior surface of the tongue, drains into IJV. Coming to the sublingual vein, it originates on the ventral surface of the tongue, course joins posteriorly with the deep lingual vein to form the vena comitans of the hypoglossal nerve. It doesn't have any tributaries and it drains the ventral tongue and the sublingual glands. Coming to the venous plexus in the head and neck region, there are three main venous plexuses: the pterygoid plexus, occipital plexus, and the pharyngeal venous plexus. So the pterygoid plexus lies between the pterygoid lateral and medial pterygoids. Occipital plexus situated in the suboccipital triangle. Pharyngeal venous plexus is located in the posterolateral region of the pharynx. So veins of the neck. So the five main veins of the neck include the external jugular vein, internal jugular vein, and anterior jugular vein, subclavian vein, and brachiocephalic vein. The word jugular refers to the throat or neck. It is derived from the Latin jugulum, meaning throat or collarbone. The jugular veins are relatively superficial and not protected by tissues such as bone or cartilage. This makes them susceptible to damage. Due to the large volumes of the blood that flow through the jugular veins, damage to the jugulars can quickly cause significant blood loss, which can lead to hypovolemic shock and even death if not treated. So, this is an easy diagram for all what all we have discussed till now. So external jugular vein. So external jugular vein largely drains the scalp and the face, but also some deeper parts. Then formed by the union of posterior division of retromandibular vein. So this diagram is the basis of the venous drainage of the face. So this diagram needs to be thorough enough for your understanding. You might not be drawing this in your exams, but it is very important for your basic understanding of the venous network. So the external jugular vein is drains the scalp and face, but also some deeper parts, and formed by union of posterior division of retromandibular vein and posterior auricular vein. It begins near the angle of mandible, just below the parotid gland, and drains into the subclavian vein. It is covered with platysma and superficial fascia and separated from sternocleidomastoid by deep cervical fascia. Tributaries of external jugular vein: the posterior division of the retromandibular vein, posterior auricular vein, posterior external jugular vein, transverse cervical vein, suprascapular vein, anterior jugular vein, and occasionally joined by occipital vein. Then coming to the applied aspects of the external jugular vein. So external jugular vein is examined to assess the venous pressure. The right arterial pressure is reflected in it because of the absence of walls. Vein is visible through the skin and can be made more prominent by blowing in with mouth and nostrils closed. Normal jugular venous pressure is 5 to 8 centimeter. The vein puncture is performed on this vein. Surgical division of sternocleidomastoid muscle requires special care of the vein. Increased venous pressure indicates congestive cardiac failure. Coming to the jugular venous pressure, it determines the activity of atrium, seen better than felt, preferable over EJV. Elevation of JVP is indicative of cardiac failure. So here we can see a man with a severe congestive cardiac failure with marked jugular venous distension. External jugular vein is marked by the arrow. So external jugular vein may serve as an internal barometer. When venous pressure is normal, external jugular vein is usually visible and superior to clavicle only for a short distance. When venous pressure increases, for example in heart failure, the vein is prominent throughout its course along the side of the neck. Coming to the anterior jugular vein, it starts near the hyoid bone, descends between the midline and anterior border of the sternocleidomastoid, turning laterally, low in neck, posterior to sternocleidomastoid, joins the external jugular vein directly. There are two anterior jugular veins just above the sternum, which communicate by the large transverse trunk, the venous jugular arch. Then the applied aspects of the anterior jugular vein is that the special care is required to preserve the vein during surgical treatment of wry neck. Coming to the internal jugular vein, so it begins the base at base of skull, and immediately below the jugular foramen, it is widened to form the superior bulb of internal jugular vein contained in the jugular fossa, located posterior to the internal carotid artery. At its lower end, at the junction with subclavian vein, IJV is again widened to form the inferior bulb lying beneath the lesser supraclavicular fossa, posterior to the sternal end of the clavicle. The IJV combines with the subclavian vein to form the brachiocephalic vein. So, coming to the starting point of the internal jugular vein, it starts from the base of the skull towards the sternal end of the clavicle. Coming to the IJV in transverse sections. So, on looking from the transverse section, we can observe that internal jugular vein within the carotid sheath, just lateral to the carotid artery. Depth from the skin surface, IJV is present deep to the sternocleidomastoid and therefore not usually felt at the surface of the skin. So these are the tributaries of internal jugular vein: the inferior petrosal sinus, occipital vein, pharyngeal veins, common facial veins, lingual veins, superior thyroid veins, and middle thyroid veins, which drain into the superior bulb. So these are the two courses towards the right and left internal jugular vein. You can note down these. Coming to the applied anatomy with the internal jugular vein, the infection from the middle ear spreads to the internal jugular vein. Surgical removal of the deep cervical lymph nodes can puncture internal jugular vein. Thrombophlebitis can occur by spread of infection into cavernous sinus. Systolic thrill is felt over this vein in mitral stenosis. In congestive cardiac failure, dilation of internal jugular vein is seen. So the deep cervical lymph node lie on internal jugular vein. These nodes become adherent to veins in malignancy or in tuberculosis. So therefore, during such operations, the vein is also resected. Coming to the jugular phlebectasia in children. So it is the congenital dilation of the jugular vein. The vein appears soft compressible mass in the neck only during the straining or crying. USG or computerized tomography are diagnostic methods to distinguish it from laryngocele or cysts or tumors, which may also appear on straining, most commonly seen in internal jugular veins. So, coming to the venous drainage of thyroid gland, so here we can see that three main veins drain the thyroid gland: the superior thyroid vein, middle thyroid vein, and the inferior thyroid vein. And we also have one fourth thyroid vein, also known as the Kocher's vein. So basically, the Kocher's vein, the middle thyroid vein, and the superior thyroid vein drain into the drain into the internal jugular vein. Okay, so but the third one, which we talked, that inferior thyroid vein, it drains into the brachiocephalic vein, not into the internal jugular vein. It drains into the brachiocephalic vein. So what is a brachiocephalic vein? It is the combination, or you can say it is the junction of the the subclavian vein and the internal jugular vein. So coming to the subclavian vein, each subclavian vein is a continuation of the axillary vein, runs from the outer border of the first rib to the medial border of the anterior scalene muscle. So from here it joins with the internal jugular vein to form the brachiocephalic vein, which is also known as the innominate vein. The angle of union is termed as the venous angle. The thoracic duct drains into the left subclavian vein near its junction with the left internal jugular vein. Coming to the brachiocephalic vein, it is formed behind the sternoclavicular joint. Here we can see in this diagram. Coming to the right brachiocephalic vein, it runs vertically downwards. Tributaries are the vertebral vein, internal thoracic vein, inferior thyroid vein, first posterior intercostal vein. This is 2.5 centimeters long. Coming to the left brachiocephalic vein, its tributaries are the vertebral vein, internal thoracic vein, inferior thyroid vein, first posterior intercostal vein, left superior intercostal vein, thymic and pericardial veins. They're 6 centimeters in long. Coming to the superior vena cava, it is formed by union of the right and left brachiocephalic veins. So it is formed at lower border of the right first costal cartilage. It pours blood into the right atrium of the heart. So this is the part 2, the venous drainage of the brain and dural venous sinuses. These both we will be discussing. Coming to the venous drainage of the brain, here in this diagram, we can see the superior cerebral veins, superior sagittal sinus, superior anastomotic vein of Trolorad, and the inferior anastomotic vein, that is of Labe. So we have to remember the names of these two major veins, the superior anastomotic vein and the inferior anastomotic vein. So the superior anastomotic vein is known as the vein of Trolad, and the inferior anastomotic vein is known as the vein of Labe. Okay, so coming to the transverse sinus, sigmoid sinus, and superficial middle cerebral vein. Okay, so coming to the diploic veins, these veins occupy channels in diploy of some cranial bones and are devoid of valves. They are large with dilation at regular interval. Their thin wall is merely endothelium. It is absent at birth, begins to develop at about 2 years. They communicate with in meningeal veins, dural sinuses, and pericranial veins. So the frontal diploic veins and anterior temporal diploic veins, posterior temporal diploic veins, and occipital diploic veins. Coming to the cerebral veins, so these are divided into the external and internal groups according to the outer surface of the inner parts of hemisphere they drain into. External cerebral veins drain into the superior sagittal sinus. The internal cerebral veins drain into the great cerebral veins of the galen. So coming to the dural venous sinuses, so they are the blood-filled spaces situated between the layers of the dura mater. These are lined by endothelium. The walls are thick and composed of fibrous tissue. They have no muscular tissue. They have no walls. So they receive blood from the brain, the meninges, bones of the skull. The CSF is also poured in some of them. So there are 23 venous sinuses, out of which 8 are paired and 7 are unpaired. Coming to the paired venous sinuses, so here we have the cavernous sinus, superior petrosal sinus, inferior petrosal sinus, transverse sinus, sigmoid sinus, phenopalatine sinus, and petrosquamous sinus, and middle meningeal sinus. Coming to the unpaired venous sinuses, so these are the superior sagittal sinus, inferior sagittal sinus, straight sinus, occipital sinus, anterior intercavernous sinus, posterior intercavernous sinus, and basilar plexus of veins. Then coming to the superior and inferior petrosal sinuses, so they are small and situated on the superior and inferior borders of the petrous part of the temporal bone on each side. In each superior sinus drains into the cavernous sinus and into the transverse sinus. Then each inferior sinus drains the cavernous sinus into the internal jugular vein. Coming to the transverse sinus, they are paired and begin at the internal occipital protuberance. The right sinus is direct continuation of the superior sagittal sinus. The left is continuation of the straight sinus. They drain from the confluence of sinuses to the sigmoid sinuses, which ultimately connect to the internal jugular vein. Then coming to the sigmoid sinus, so they are the direct continuation of the transverse sinuses. Each sinus turns downwards and medially to groove the mastoid part of the temporal bone. Here it lies behind the mastoid antrum, and then it turns downward through the posterior part of the jugular foramen to become continuous with the superior bulb of the internal jugular vein. Then coming to the superior sagittal sinus, so it occupies the upper fixed border of the falx cerebri. It begins in the front at the foramen cecum, where it receives a vein from the nasal cavity. It runs backwards, grooving the vault of the skull, and at the internal occipital protuberance, it deviates to one side and becomes continuous with the transverse sinus. Then coming to the inferior sagittal sinus, it occupies the free lower margin of the falx cerebri. Then it runs backwards and joins the great cerebral vein, which is formed by the union of the two internal cerebral veins at the free margin of the tentorium cerebrali to form the straight sinus. It receives cerebral veins from the medial surface of the cerebral hemisphere. Coming to the straight sinus, it occupies the line of junction of the falx cerebri with the tentorium cerebrali. It is formed by the union of the inferior sagittal sinus with the great cerebral vein. It ends by turning to the left, sometimes to the right, to form the transverse sinus. Coming to the occipital sinus, it is a small sinus opening, also occupying the attached margin of the falx cerebri, and it communicates with the vertebral veins near the foramen magnum. Superiorly, it drains into the confluence of sinuses. Coming to the cavernous sinus, so it is situated in the middle cranial fossa on each side of the body of the sphenoid bone. So we will be having a different lecture on the cavernous sinus as well, dedicating only the cavernous sinus. So here we are. I'm giving only in short the details of the cavernous sinus because it in itself is a very big topic which needs a separate video. So each sinus extends from the superior orbital fissure in front to the apex of the petrous part of the temporal bone behind. The third and fourth cranial nerves are and the ophthalmic and maxillary divisions of the trigeminal nerve run forward in the lateral wall of the sinus. The internal carotid artery, its sympathetic nerve plexus and abducent nerve runs forward through it. So coming to the tributaries of cavernous sinus. So this diagram you can be using. So it receives blood from the orbit, brain and the meninges. Coming to the communications of the cavernous sinus, so the first communication is by the transfer to the transverse sinus to the superior petrosal sinus, internal jugular vein through the inferior petrosal sinus, pterygoid plexus through emissary veins, facial vein through superior ophthalmic veins, cavernous sinus of opposite side through anterior and posterior intercavernous sinus. Then coming to the emissary veins, we have already discussed this before. Thank you.